pleased to introduce you to this delightful young individual, 22-year-old female who unfortunately was diagnosed with very advanced Hodgkin's lymphoma a few months ago. When I saw her, she was introduced by a patient of mine to me, and she had resisted conventional treatments as far as performing traditional chemotherapy in her situation. She was only 22 years old, and she didn't want to suffer from toxicity of these drugs. That said, we always encourage the patients to follow with their oncologist recommendation. And in this situation, we did refer her to the oncologist that we work with. And it was very interesting that we both agreed that the treatment that was initially recommended to her by her oncologist at her hometown in Santa Barbara, which is called standard of care for Hodgkin's lymphoma, was not the treatment that we would like her to be on because of the severe toxicity. That said, she was also suffering from a very advanced disease, and we were challenged if the modified sort of a treatment will even be effective. We did a PET scan before we started her on the treatment. I also ordered a molecular profiling on her tumor. The PET scan showed that she has very advanced disease with involvement of the left neck masses and lymph nodes in several areas, plus that she had several thoracic involvements of the lymph nodes in the chest. And also, as far as the staging goes, the tumor also had invaded the below diaphragm area. So she had portocaval lymph nodes that also were showing up with very highly metabolic activity in the PET scan. I was personally challenged if my treatment with the targeted drug could be enough for her, and refraining from cytotoxic drugs in her situation would even work. But we started her under treatment about a month ago. She followed my recommendations. She came to Fresno and received the treatments on a daily basis. We also started her on rituximab, which has a very synergistic effect with our therapy. And it proved that our therapy, in a matter of just 4 weeks, was able to quite significantly be effective, both clinically as well as radiologically. So what we did was that we did a whole body, restaging whole body PET scan just after 4 weeks of treatment. That showed immediate resolution or substantial decrease in activity and the sizes of all lesions. Many of them completely disappeared. She did not have any below the diaphragm portocaval lymph node involvement anymore, and what was left in the neck had minimal activity. Clinically, when I saw her about a month ago before we started the treatment, she was pale, she was anemic, she was very, very desperate. After just a few weeks of treatment, this lady regained her function. She was able to perform as a young individual who has never had cancer. And so I'm very happy to also introduce her in the next video when she shares her story. Thank you.
Hi, my name is Sarah, and I started with Dr. Nezami about 6 weeks ago. I met him in his office in Orange County, and that whole process began because I was referred here by my friend Jenny, who had an amazing experience with Dr. Nezami and really felt like God led her to Nezami to be paired with treatments to take care of this cancer she had found in her body. I had gone to an oncologist, and he told me you'll be doing about 4 months of chemo, and it'll be good, but it'll be hard, and we're going to treat it and get through it. And it was good information to take in, but I was kind of determined to find another, or just an alternative way. I didn't really want to do the full chemo, and since Jenny had had such a positive experience here with Dr. Nezami, I really wanted to get his opinion. So I went in and met him, and I was nervous at first because this whole just having something that you're sick with or whatever is just intimidating, and it's weird, and so a bunch of doctor's appointments wasn't in my 5-year plan, but I started that whole journey and knew that I wanted to do it right, do it with open hands and open heart. And so when I went into Dr. Nezami, it was very different than my meeting with the oncologist, and as some of these other probably pause for a second, but some of these other testimonies show that he is very different than the other doctors that you will meet and get to know. And so it went really well, and I learned so much about my type of cancer that the oncologist hadn't shared with me. The oncologist had a very brief overview of Hodgkin's lymphoma, and this is kind of what it is, and this is how we're going to treat it, and we've done it 1,000,000 times. And so I was like, okay. But going to Dr. Nezami took a much more specialized route, and that was just really, really helpful. You know, he knew so much more than the oncologist I had seen had, and that really made me feel at peace. And so I wanted to go his route. And so I've been here, like I said, for about 5 weeks, and my body, I feel great. I didn't realize how low energy I had when I started until I've begun gaining energy back, and I'm about finished, and we'll see what the next results hold or what the next chapter of the journey has. But I'm feeling really great, and my blood work has come back so much better than when I started. My blood platelets are in normal range, and that's just really exciting. So every bit of information I've had has gotten better and better and better, and so we're hoping for a full and complete healing of it. But it's just been a really great experience, and all the people here have just been so helpful, and they know what they're doing, and the nurses are not all the doctors, they're just like, they're so good with you and treat you really well, and it's just been so neat. And then you get to meet lots of new people, so that's been one of my favorite things, is meeting a bunch of people who I wouldn't have met. And yeah, I'm really grateful.